Y'all ready? Y'all see? Counter sort of? Maybe. All right, so, sorry. All right, so I'll just try to take it structure by structure the way it is in the list. It's pretty straightforward. First, you have the oral cavity, or the mouth, obviously. I mean, that shouldn't be a hard thing. The tongue is also there, but this tongue isn't protruding. It is hit or miss. Nobody's trying to break his jaw to pull out a tongue, all right? I'm gonna be honest with you. But you do have tongue on that structures list. Remember we just talked about the parotid salivary gland in our little discussion? So if you look, here's the ear right here, right? In a human, the parotid salivary gland was just anterior to the ear. So we cut a little flap, and you see this kind of, it almost looks grainy right here. See the location of it? There's the ear, here. See the location right here? That's the parotid salivary gland in the cat. Same location, just anterior to the ear. It kind of looks like it's on the side of the head, which it is, but parotid salivary gland kind of looks like a pork chop almost. It's kind of grainy, it's whitish in color right here. All right. All right, next up we have the esophagus. So we have to come toward the midline of the neck, okay? And next week we'll talk about the respiratory system. There's a tube of the respiratory system called the trachea. You do have that on your list, so I'm gonna show you that first because it's actually more superficial. The esophagus is located behind it. So with the trachea, this is it right here. I'm gonna lift it up right there. You see the little kind of bands? They almost look like a more intense color of white, so it's kind of clear then white, clear then white. Those are called tracheal rings, and that's what helps reinforce the trachea and keep it open. Now, located behind the trachea, that's where you find the esophagus. So here's the trachea. We're going to lift it up, and then behind the trachea here, that's the esophagus. It's a flat, muscular tube that allows food and liquids to pass from the throat or the pharynx toward the stomach, which is going to be in the abdominal cavity, and we'll get to that in a moment. So again, we have trachea, and then we have esophagus located behind it. Now, another structure that you have, it's a little out of order, I think, but toward this superior margin of the trachea, when I say superior, I mean the top. See, we come up. Right here, there's a little cartilage-based box. I'm gonna see if I can dissect this out just a little bit. Kind of clean it up maybe so y'all can see it. So just had to snip a little bit right there. But you see this? It looks white, and I'll try to tap it so you can hear. Well, you can't really hear. But if you had gloves on, if you want to get some and feel this, you can. But you would be able to feel this is a little firm. It's not bendable like this trachea, but this cartilage-based box right here, that is the larynx. It's what houses the vocal cords. All right, so the larynx is here. It's at that superior margin of the trachea. Next, we have the thyroid gland. Well, this white cartilage that you're looking at, that's actually thyroid cartilage. And if you look just below it, see kind of how it has this yellowish, whitish, it almost looks like fat. That's the thyroid gland, actually right below it. All right, so you got the thyroid gland right through here, and that's kind of hard to keep, because it usually gets obliterated as you start to try to dissect out. If I was to clean up the larynx, the thyroid would go away. That's why I didn't clean it up completely. All right. So parotid gland, larynx, trachea, esophagus is behind that trachea there. And y'all can take a pause or stop a video because I'm not trying to make y'all have